So we want to also look at what we call a statistical inference. In this bit of discussing probability, we want to use statistical inference as another key term in the art of probability. And we're saying that a statistical inference is like making educated guesses about the entire population based on what we see in our sample. So it involves sampling and so forth. So statistical inferences are very big. I'm sure you've covered it in part of your biostatistics lectures. Uh, but here we want to just understand in our context of probability how it happens. So probability forms the foundation of this process, and it is crucial for understanding the improving estimations. So what happens is that statistical inferences are just a process of using a sample to meaning that to make a decision, or it is like a hypothetical uh, discretion. They help you make a decision on the properties of a population. Statistical procedures use sample data to estimate the characteristics of the whole population from which the sample was drawn. So you can be able to make statistical inferences and conclusions. You can be able to have a sampling, and then from that sampling, you're able to make conclusions on a wider population in regard to your observation. So scientists typically want to learn about a population. Now, when studying a phenomenon, for example, we want to look at the effect of a new medicine, uh, or we want to understand the public opinion, or we want to understand the results at a population level. For example, let's say we have the COVID vaccination that has been carried out in a particular population. Or per se, let us say there is a new dosage of antimalarials that have been introduced in a population. So we want to understand what are the effects, or we want to understand what is the population's opinion, or want to understand further what are the results of this new kind of medication at a population level. So it is much more valuable now than understanding only the comparatively few participants in the study. So in statistical inference, you can be able to project uh, from your sample what actually is the ideal outcome of this particular new medication. So how do we make statistical inferences? In its simple form, away from what you could have covered in one of your course units, deeply in statistical inferences, here we are saying that the simplest form of making a statistical preference or inference requires you to do the following. One is that you draw a sample that adequately represents the population. So this is where we are talking about in terms of of probability. So if you're having 10,000 youth, uh, then you cannot sample 10 of them and you expect that you will come up with a conclusive statement that favors all the youth, or that is for all the youth. Two, you have to measure your variables of interest. What do you want to measure? You want to measure uh, the effectiveness of disease. So, for example, if you want to make a statistical inference on a new medication, say we have an antimalarial, like I said before, so you should be able to estimate how from your sample study from your hospital. Let us say you want to understand uh, medication from your new medication in this particular health facility. So you will look at how many malaria cases were there. Let us say we had 100 malaria cases. Now, that is your sample, 100 malaria cases. Now you want to know the outcome of this medication. How many of them were put on treatment, on that new treatment? So you can be able to estimate out of 100 people, if you picked 50 people who were tested positive for malaria and put under the new malaria treatment, and uh, ha- uh, and 50, all the 50, the ones you sampled, 50 of them got healed or got the therapeutic right, then you can make a statistical inference out of that sample that is adequate. So the the variable you're measuring there would be the effectiveness of the drug. So the the third form is that you have to use a very appropriate statistical methodology to generalize your sample results to the population while accounting for sampling area. So you know that there is the sampling error, but here you have to use the statistical methodology that is right. We shall be looking at some of the statistical methodologies that you can use to actually do your sampling. But of course, that is just a very simple version of making statistical inferences, like I said earlier on. So, however, in the real world experience, you might need to form treatment and control groups and administer treatments and reduce other sources of variations. So, in your real scientific research, you may just have to create a control group, meaning that there's a group that you can give the treatment, then the other group you do not give them the treatment. So when you do the comparison, you can be able to assess the effectiveness of this new particular drug. So in more complex cases, you might even need to create a model of a process. There are many details in the process of making a statistical inference. So that is just the brief we want to discuss, regarding statistical inferences.